Good afternoon, everyone. Myself Rahul Ladumot. I am a student of massage therapy program at Sentinel College. Today I am going to talk about the trigeminal nerve. Trigeminal nerve has a two component, motor component and the sensory component. To begin with sensory component start with the sensory cortex of the brain. They enter through the brainstem via midbrain, and at the level of medulla oblongata they synapse with the spinal nucleus. After that, this sensory route travel towards the trigeminal ganglion. At the level of trigeminal ganglion, sensory route divided into three divisions. First division, which is known as ophthalmic division. Ophthalmic division provide a sensation from orbit skull to the nose level. Second division, known as a maxillary division. Maxillary now provide a sensation from the lower eyelid to the upper lips area, this area. And the third division, which is known as a mandibular now provide a sensation from lower lips to the jaw area and the tongue. So now I'm going to talk about the motor component of the trigeminal. Motor component of the trigeminal now, they starting with the motor cortex of the brain. They enter to the brainstem via midbrain. At the level of pons, they synapse with the masticator nucleus. So from masticator nucleus to the motor cortex, which is known as upper motor neuron. So after upper motor neuron, they synapse with the masticator nucleus and they travel towards the trigeminal ganglia, which is known as the lower motor neuron. At the level of trigeminal ganglia, they provide only a motor function to the third division of the trigeminal, which is known as the mandibular level. So the mandibular now provide motor function to the muscles of mastication. Muscles of mastications, there are four muscles included in this mastication. First muscles, which is known as a masseter. Second, temporalis. Third, medial pterygoid. Fourth, lateral pterygoid. So the movement of the mastication is the elevation of the jaw, depression of the jaw, protrusion of the jaw, and retraction of the jaw. To register this movement, I'm starting with the elevation which is done by the superficial masseter and temporalis muscle. For that, to register this movement, therapists need to stabilize the cheekbone. Patient need to open the jaw and try to touch the teeth. Second movement, depression of the mandible. It is done by the medial pterygoid. To register this movement, therapist need to put the hand just the bottom of the mandible. Patient need to open the mouth, and therapist need to just register the movement. Third movement, which is a protrusion of the mandible, which is done by the lateral pterygoid. So protrusion, for the therapist need to push the mandible. Fourth movement of the muscle, which is known as a retraction of the mandible, which is done by the deep masseter. For that, therapist need to pull the mandible away from the body. So these are all the movement of the mandible. Now I'm going to talk about a deformity of the trigeminal nerve. So there is a one deformity which is known as a trigeminal neuralgia, in which it is done by the any compression throughout the trigeminal root. So in which patients feel a sharp shooting pain and electric shock on the one side of the face. Thank you.